Good morning. I'm Michelle Corson with Kern County Public Health, and I'm here to provide you with an update on COVID-19 and its impacts on Kern County. And I'd like to start out with thanking our community. This past Easter weekend is a time where many of us go out and about, and we frequent our local businesses and we frequent our local parks. And we made a great effort to remind people of the importance to stay home over the Easter weekend. And Kern County, you listened. We have received really positive reports from a lot of our local parks that have indicated that the crowds remained low, that gatherings were not occurring, and that you heeded the guidance of our governor and our local officials to stay home during Easter. And this truly is going to make such a difference. If we continue this, this is the one way together we can really slow the spread of COVID-19 in Kern County. So thank you very much for working with us this past holiday weekend. I'd like to go over the statistics now. The California Department of Public Health reports as of April the 11th, 21,794 cases and 651 deaths. Here in Kern County, as of 8:45 this morning, there have been 436 cases confirmed, plus 8 non-residents and 3 deaths. As far as testing goes locally, we have had 6,533 local tests conducted, 3,554 are negative, 2,535 are still pending. And now the way that the age breakdown occurs for our positive cases, that's as follows. Ages 0 to 17, 20 cases. Ages 18 to 49, 248 cases. Ages 50 to 64, 107 cases. Ages 65 and older, 48 cases. 38 of Kern's positive cases have been hospitalized at some point during their illness. And finally, the CDC has issued guidance for releasing positive COVID-19 patients off home or hospital isolation. This is an indicator that patients are no longer infectious. So far in Kern County, there have been 113 residents or cases that have met that criteria and are no longer in isolation. I would like to talk about the business updates for our essential businesses and the governor's order on what should be operating at this time safely. Again, we really want to thank our local businesses. The majority have heeded this guidance from the governor and local officials and have followed the order regarding business operations during this time. To date, though, Public Health has received over 1,500 complaints, and we have responded to over 840 of those of businesses that remain open despite the governor's order. A follow-up inspection of facilities has resulted in 1 law enforcement citation issued by the Bakersfield Police Department under the health officer order to a local gym. We will continue to receive complaints and follow up on these complaints on a weekly basis. Finally, we can't stress enough the precautions that we all should be taking, and I just want to run through those again. Of course, stay at home except for essential services. Practice social distancing. Do not get any closer than 6 feet with people that don't live in your household. Wash your hands with soap and water at least 20 seconds. Avoid touching your eyes, nose, and mouth. Cover your sneeze or your cough with a sleeve or a disposable tissue. And avoid any close contact with people that are sick. These steps are things we should be practicing on a daily basis. this is, again, we've got the ability to really make a difference on the way that COVID-19 can slow and stop spreading here in Kern County. And I just want to remind everybody that our website is updated on a regular basis, kernpublichealth.com, and our call center remains open 7 days a week, 8 a.m. to 5 p.m. to receive your questions. And we really look forward to speaking with you about any COVID-19 related questions you may have. And with that, I am going to invite my media friends that are on the line with us as we continue to practice social distancing. They've called in today. And my media, I need you to hit *6 on your phone. And you're unmuted. And so what I'd like to do is I gave an order so that we don't talk over each other the best possible. If we could get started, and I'm ready for the first question.
Hi, Michelle. It's Emma Goss from Channel 29. Can you hear me?
Hi, yes.
Thank you. I wanted to ask about Kern County's spread rates of COVID-19, looking at other counties in the Central Valley and around the state. It looks like ours is climbing at a much faster rate when you compare them. Is that at all true? And what do you make of that?
So, yes, we see and we watch what the California Department of Public Health is reporting in other counties. As far as us being able to give an accurate description of our spread and how that compares to other counties, it is still really early on in the process. What we do know is our cases continue to grow. What we also know is the number one thing that our models have indicated that can slow the spread is social distancing. So at this point, we just encourage our community to continue that social distancing, and as we move along in this, we will be able to provide more data and the comparisons. So thank you, Emma. Next question.
Michelle, this is Kylie with 23 ABC. Should we expect Kern County's curve to flatten anytime soon?
We hope that the curve will flatten. Again, on Emma's question, we know social distancing is the key to this. We know that a lot of our residents did what we asked and did not go out and gather in parks this weekend. We're hearing really positive reports about that. So we hope that the curve will flatten. We hope that we see the tests and the positive tests decline at some point. It's just too early, so we just need to focus on what we can do right now.
Mm-hmm.
Next question.
Hi, Michelle. This is Karen Hua from KGT 17 News. Can you hear me?
Yes.
So there are an increasing number of pending tests every day. That pending number has not decreased or it has not plateaued, and yesterday 50% of those pending tests came back positive. Is that pending number concerning to you that's growing? And how can we process these tests faster?
So when it comes to the tests and how quickly they are processed, there are so many different facilities that are conducting these tests now, and all local hospitals have the ability. So for us to comment on that is difficult because we're not involved in those day-to-day operations. What we're involved in is that they must report that to the Public Health Department, which they are. So again, the hope is that as a state, we make testing more regulated and more expansive, that this begins to become less of a wait time. But we too, we just have to know that at least the testing is happening. It has been increasing and becoming more readily available to our residents, and we hope that those wait times begin to lessen for the test results to come back. Next question.
Hi, Michelle. It's Rob King from KUZZ. How you doing?
Hi. Good.
As I'm looking at the map, I'm noticing Bakersfield East has surpassed West. Has Kern Public Health noticed this pattern as well, and are you putting any reasoning behind it or any weight with it?
Of course, we've noticed the the way that East has risen, especially after West had been in the lead for so long. Again, there is no pattern that is identifiable at this point where a person is tested positive and where their residence is. There's so many factors that play into this. Where is their home in relation to where it is they're getting tested? Things like that. So at this point, we don't have an answer. Again, this is so new. We're so early on. We have epidemiologists that evaluate all of this data on a regular basis, and establishing patterns is something as a health department we want to do and plan on doing as more time progresses. Next question.
Michelle, can you hear me? It's Ralph Bailey, Kern Radio.
Hi, Ralph.
We know that African Americans are more greatly impacted by the virus than other groups. We know this because health officials in other counties and other states are providing that kind of data. Even here in California, in Santa Barbara County, they give daily status of patients, count of hospitalizations, number of patients in ICU, number of healthcare workers that are sick. And in Monterey County, they list by folks that have pre-existing conditions, whether they had pulmonary situations or diabetes or high blood pressure. We are not getting anything close to that. Are these counties violating the law? And why aren't we getting more information on our patients?
This is obviously one of the most asked questions. Let me answer this in two parts. First, you indicated the disproportionality with African Americans. What I will plead with everyone listening is to visit the California Department of Public Health's website, where they have outlined in great detail the ethnicity and racial breakdown of COVID-positive cases throughout the state. And thus far, as a state, they are indicating that that is following in line with the racial diversity of our state. So that disproportionality is not showing up in their data right now, though I have heard the national conversation around this, Ralph. But early data is not suggesting that currently. And when it comes to what Kern County Public Health, the data that we are releasing, we take this so seriously. We do, and we've said repeatedly, we follow and we choose to follow the state guidelines on this and HIPAA. We release information as it is in our best interest to do so, to serve our community. However, we take these guidelines seriously. I can't answer why other counties don't choose to follow that, but I'd also like to say, no matter if we broke it down to the most finite zip code and gave more identifying information, it is important that our entire community acts as though COVID-19 is spreading and that it is in your own neighborhood. That is why the stay-at-home order is so important. That is why social distancing is important. If you have a vulnerable health condition, you should not be going out. If you are elderly, people should be bringing you your essentials. There is a statewide hotline set up for our more vulnerable residents so that they can stay at home. So I just cannot urge our community enough, no matter what data we were to provide you, it is essential that you follow the protocols. And if you do that, that is the best way to stay safe during this time.
And Michelle, this is Kylie with 23ABC. Speaking on the social distancing, about a week ago we received a failing grade in Kern County for social distancing, and then with the party of 400 people this weekend, do you guys expect to see a peak coming soon?
We are familiar with that poor grade, and a lot of that has to do with cell phone usage and things like that. So, hearing that is, of course, concerning to us. We also are aware of what happened with the party this weekend and that mass gathering that is very disturbing to us, obviously. So, do we expect to see a peak? Not necessarily, but we do expect that people take personal responsibility and that they stay home and they don't gather. This is a time for us all to hold each other accountable. So I hope that answers your question.
Mm-hmm.
Next question.
Hi, Michelle. Hi, Michelle. This is Karen Wall from KGT 17 News. I understand you're not necessarily able to give out the number of cases in each city, but could you perhaps break down the map for people who might have trouble understanding it? Like, what cities are in Bakersfield East? Because that doesn't mean East Bakersfield. What cities are in the Mountain District? What cities are part of each of these very broad regions that you're giving?
Okay, so your suggestion is it would benefit the community to have within our breakdown, our geography breakdown, the cities that are within that. That would be helpful to list those out in the areas that we have identified.
I think there's just been some confusion of,
Okay.
For example, when we say Bakersfield East versus East Bakersfield, like, could you perhaps clarify what cities are in each of these 5 geographical regions?
I think that's something we can definitely take a look at, and thank you for the recommendation, and that's something that I will look into. Thank you, Karen.
Thank you, Michelle.
Any
Michelle,
other?
it's Bailey again, Kern Radio.
Yes.
We see the spike, and the Surgeon General tells us that the worst is coming. How are we in terms of PPEs and ventilators here locally?
So we continue to receive requests from all of our partners. Healthcare and first responders are a priority when it comes to our PPE. We received these requests, then we put a request into the state, and last week we received an order, and I'm happy to say today we expect an order to come for PPE that we need to fulfill the requests that we're getting on a daily basis. So I'm not aware of any shortages at this moment, but it is very dependent on us continuing to receive that flow of the state providing us what we are requesting of them. So thank you. All right, I have a time for a couple more questions.
Michelle, this is Kylie with 23ABC. Have you guys have any cases been successfully traced back from where they originated?
I don't know if I understand the question.
Okay, I'll ask a new question. This question is, in LA, they are requiring now by law to have everybody wear a mask. Is that something that we're going to be implementing here? And also, have we discussed possibly giving out tickets for non-essential driving like they're also doing in San Diego?
Currently, when it comes to the face coverings in Kern County, we are following very closely what the Centers for Disease Control and the California Department of Public Health has recommended, and those are voluntary, and those are recommended, though, if you are going out and you are unable to practice social distancing. So we definitely recommend that our community follow that if they're going out covering their face, if they cannot practice social distancing. So at this time, we are not enforcing anything. We are strongly recommending it, along with all the other, stay at home and things like that. And one more question.
Michelle, can I get one last question?
Can you hear me?
I can hear you.
Hi, Michelle. I have a question just going back off of releasing identifiable information. I know someone already asked about that. And you talked about how you're following the state guidelines and that there's some counties, you said, I can't answer why other counties choose not to follow those. Are you saying that other counties, just to clarify, are not following these state guidelines and they are violating HIPAA by releasing identifiable information?
What I am saying is that we are following. I truly can't answer for other counties. There's a lot of nuances in the way that you release data. What I can say is it's something we take seriously, and we choose to follow the guidelines by the state and HIPAA. And
Thank you.
You're very welcome. And I'm going to go ahead and close this out for now. I really appreciate the media calling in, and for those of you that have tuned in, thank you. And we just encourage you to continue to stay home during this time and follow us on social media and our website. And everyone take care and stay safe.
Bueno, básicamente noté un incremento. Por lo regular, las cifras de personas diagnosticadas con COVID-19 se mostraban en el lado oeste, ¿verdad?, de Bakersfield. Pero a partir de este fin de semana hubo un cambio y como que se está viendo más personas en el lado este de la ciudad. ¿Me equivoco? Está bien, ¿verdad?
Sí, estás en lo correcto.
Ok. ¿A qué crees tú, Ellie, que se deba este cambio? No es muy drástico, pero sí de todas maneras es notorio. ¿A qué crees que se deba?
No sé a qué es lo que se deba, pero puede ser de que es la forma en que se están reportando. También puede ser en el número de pacientes que están yendo a hacerse las pruebas en diferentes lugares a través del condado de Kern.
Ok, ahora, se está viendo más personas con sus cubrebocas en la calle y en varios lugares, ¿verdad? Pero todavía hay personas que salen y que van a las tiendas y están en contacto directo, no cercano, pero sí directo con otras personas. ¿Cuál es la recomendación, o mejor dicho, qué es lo que el Departamento de Salud está pidiendo, ya no tanto recomendando, sino pidiendo que hagan las personas tocante a eso, Ellie, o todavía es opcional?
Aquí en el condado de Kern todavía es opcional, sin embargo estamos siguiendo muy de cerca las guías y las recomendaciones que hicieron los centros de prevención y control de enfermedades y también las recomendaciones que dio el Departamento de Servicios de Salud Pública de California sobre los tapabocas. Se recomienda de que sí las usen si salen para servicios esenciales y que va a ser muy difícil hacer el distanciamiento social.
Ahora, ¿esos tapabocas son para adultos o los niños también deberían de utilizarlos, Ellie?
No se recomienda para niños menores de 2 años, sin embargo, para personas de edades, para niños de mayores de 2 años en adelante, sí se recomienda usar ese tapabocas.
Muy bien. Ahora, los trabajadores del campo, los campesinos, pues ellos haciendo un trabajo esencial continúan trabajando. ¿Está alguien monitoreando, Ellie, que los campesinos realmente, en primer lugar, les permitan guardar la distancia de 6 pies y, en segundo lugar, que estén trabajando con sus tapabocas y con todas las medidas de seguridad que se requiere para todas las demás personas? ¿Hay alguien monitoreando eso en los campos, Ellie, que tú sepas?
Se ha puesto una guía por el Departamento de Servicios de Salud Pública de California, especialmente para los trabajadores agrícolas que trabajan en la agricultura, y esa guía es muy específica y la deben de seguir todos los mayordomos o empleadores de estos empleados trabajando en el field. Entonces, si tienen preguntas sobre eso, nos pueden llamar y también visitar nuestra página web, que es kernpublichealth.com, y esa guía es muy importante de que la sigan, de tomar esas prácticas, ¿no?, del distanciamiento social, de usar el tapabocas si es necesario.
Muy bien, Ellie. Ahora ya por último, nomás algún otro mensaje que quieras tú darle a la comunidad hispana ahora que iniciamos esta semana con más de 400 casos que realmente los alcanzamos y los superamos en unos cuantos días. ¿Cuál es tu mensaje para la comunidad, Ellie?
El mensaje es de que esto es un virus que uno se lo tiene que tomar uno a la ligera, ¿no? Recordar a nuestra comunidad que es muy importante practicar el distanciamiento social. Es muy importante quedarse en casa y salir solamente para servicios esenciales. Es muy importante practicar el higiene de lavarse las manos por 20 segundos con agua y con jabón, taparse la boca con el codo o con un pañuelo desechable cuando estornuda o tose, y mantenerse alejado de personas que están enfermas. es muy importante seguir la orden del gobernador de quedarse en casa para reducir o detener la propagación de COVID-19 aquí en el condado de Kern.
Muy bien, Alice. Pues gracias por tus consejos y gracias a ustedes por el trabajo hacia nuestra comunidad. Que tengan buena semana. Vamos a ver qué pasa toda esta semana.
Sí, muchas gracias a ustedes.